In a natural cycle, a woman will only grow 1 or 2 follicles leading up to 1 or 2 eggs being released at the time of ovulation. For IVF treatment, we really need to have several eggs, and it's because of this we stimulate the ovaries with medications to encourage a number of eggs to grow during the treatment cycle. Without getting into too much complexity, there are 2 main types of stimulation protocol. One is known as the long agonist protocol and the other the short antagonist protocol. There's not much to choose between the 2, but there'll be some women who'll do better with the short protocol and some women will do better with the long protocol. During the treatment cycle, we do ultrasound scans to count and measure the follicles, and we can also do blood tests to measure estrogen and later on in the cycle, estrogen and progesterone, which gives a good idea as to how well the cycle's progressing. When the follicles reach the correct size, a final injection is given to mature the eggs, and this is followed 36 hours later by the egg collection. This is done under transvaginal ultrasound guidance and involves a needle into each of the follicles one by one to drain the fluids off. The fluids are looked at down the microscope by the embryologist to identify the eggs, and the eggs are put into the incubator. Later that day, sperm are added to the eggs, or if there's concern about the ability of the sperm to fertilize the eggs, the sperm are injected into the eggs. The embryos are then grown in the laboratory to day 5. This is the blastocyst stage, at which time we do the embryo transfer. Typically 1 embryo will be transferred, or sometimes 2 embryos, and if there are any good quality embryos surplus to requirement, these can be frozen and stored for subsequent frozen embryo replacement cycles.